Good morning all. Welcome to Taxila Education Channel. Today we start with the other topic, growth and development. What is our topic? Growth and development. Introduction of lifespan and development. What is lifespan? The lifespan means the human child first in the womb. Okay, the mainly thus the baby is like the stage of the baby is a zygote from the person who is comes out from the womb and developed. After that, he completed his lifespan and finally he went to normal death. That is the normal lifespan of a person. Lifespan is deal with a lot of stages. Okay, from the embryo is developed or the zygote is formed. From that stage to the older stage. Okay, elder stage or adulthood stage, it comes and end. Okay, lifespan has lot of stages. First stage of lifespan is started with the form started with the cellular form. Okay, you understand? Whenever the sperm and the egg is fused, from that stage to whenever the person is normally died, from that stage, that is the normal lifespan. A normal lifespan of the person depends upon each personality. Okay, in each person their lifespan is different. Mainly from the psychologists are commonly derived from the zygote to early adulthood. Okay, that is the mainly the 0 to 65 is a yearly calculation. Some people live more than 65 years. Okay, some people live less than 65 years. We want a classification, that's why they are doing this. Okay, what do you mean by growth? Growth is defined as increase in the size or development is defined as the progression towards the maturity. Okay, what is the difference between growth and development? Growth means how to increase. Okay, how to increase the size. Okay, how to develop a person by size. And development means how to attain maturity. Some people have 45 years now, till now they doesn't have maturity. Why? They doesn't develop it at all. Okay. The scientific study of development is important. Development is mainly based off the psychological development, sociological development. It depends upon each person different. Okay, some persons have maturity in their 13, 14 years old. Okay, some people have never get maturity in their 60s. Okay, adulthood 60, 65, they doesn't have even maturity. That's the main reason the development is based on psychological and sociological life, and the growth is depends upon physical development. Then problems in the lifespan development. What are the problems that affected in the lifespan? Some people's hereditary is the problem. Some people have this much of your lifespan. Some people live only in the early 30s. Some people died. Okay, so the lifespan has depends on some problems in lifespan is there. Continuity, one of the main problem is continuity and discontinuity. It's become then next point is stability and change. In stability and change, there is the nature and nurture. Nature versus nurture. This is the one of the important topic. I will tell you later in widely, okay? Otherwise it will be become more problematic for you, okay? It's very confusing. What is nature versus nurture theory, okay? The continuity and discontinuity. Continuity means the development has continuity, okay? Development will continually. It may be quality behavior development or structural development, okay? It qualitatively it's measured by qualitatively the continuity, stability and changes, okay? Discontinuity means in sometimes the psychological factors or behavior factors or our society give some pressure to the pupils or pressure to the individual that causes discontinuity in the qualitatively developing personality or behavior, okay? Okay, stability or and change. What is the stability and change in person who develop in their early childhood? They have some shyness and stage fear or like that, some problems are there, but in their adolescent period or in their adulthood time it will be vanish. That is called stability and change, okay? It makes defining the person's behavior, okay? By developing each, they cover each and every stage of development. They change their personality or behavior. That is called stability and change theory, okay? Nature versus nurture. What is that? Mainly that lifespan is depends upon the environmental factor, okay? That affected a lot of things, okay? In Hiroshima and Nagasaki, they have some problems in development, okay? In endosulfan region, they have some problems in development. Endosulfan is emitted, that's why they have, mainly the children have hydrocephalus, okay? That's why the development is depends upon the environment. What is the environmental factor? Good, what is pure air, pure water, pure atmosphere, healthy lifestyle. These all things are affected in the person's lifespan, okay? Then next important topic is stages of lifespan or stages of development, okay? Prenatal stage, that I told you, whenever the egg and sperm is fused, a zygote is formed. That is called prenatal stage, okay? Then next stage is infancy. Then the next stage is early childhood. Then middle and late childhood, okay? Then adolescence, then early adulthood, middle adulthood, late adulthood. These all stages are there. Okay, what is comes under prenatal stage? The prenatal stage means whenever and the egg and the sperm is fused and form a zygote. Okay, that zygote is developed into an embryo. That embryo is in the embryonic period of the early 2 to 8 weeks. After that, the fetal period is that 8 to 9 weeks of birth. Okay. Okay, that are all things are whenever the baby is in the gestational period, that is called prenatal stage. Okay, prenatal stage has mainly in 38 to 40 weeks. In 38 to 40 weeks, we divided the prenatal stage into three trimesters. The first 3 months is the first trimester. That phase is called movement phase. Okay. Second trimester comes 3 to 6 months. That mainly occur in the brain development of the baby. And then 6 to 9 months the baby grow up. Baby's muscle growth and bone growth, systemic growth, everything is happened in the 6 to 9 months. That is the third trimester. Okay, first trimester, first 3 months. The third month, the baby attain the slight movements. Okay, in after our first trimester, baby moves little bit. The movement we can feel in the ultrasound. Okay, can't feel in the person's tummy, we can't touch or palpate, we can't feel. By the help of ultrasound, we can feel the baby is moving his hands, legs, everything. Okay, but we can't define it more. Okay, then after 6th month, the baby started with the brain growth. In that time, baby is started with kicking. The kicking is started on 6 months. Then the 9 months, the baby developed more. Then the baby will doing turn around in the womb. Then that time the baby's mother feel more discomfort. Okay, this is the prenatal development of a zygote. Zygote comes to embryo. How come zygote form? Zygote form the fusion of sperm and egg. Then the zygote is formed. Then after that is zygote. Inside the cells of the zygote form a blastocyte. This blastocyte is developed into embryo. Then the 2 to 8 weeks, the embryonic development is started. After that, the fetal period started. In that 2 to 8 week, what happened? First 2 months is overing. Okay. After that, the third month. Okay. First trimester is stopping in the third month. After the third month, the baby started with moving. Complete zygote development happened. The fetal period ends that time. Okay. The phase of prenatal has divided into 3 periods. The germinal period that I told you, the sperm is developed. In the sperm and egg get fused. Then the blastocyte is formed. Then it converted to embryo. Okay, that is called the germinal period. Okay, after that embryonic period, then this embryo want to development. Our CNS is developing that time. Central nervous system. Okay, embryonic period 2 to 8 weeks. That is the first 2 months. Okay, then after that fetal period. It is what? After it comes after 2 months. 2 months to 3 months is the fetal period. That is called the 3 months till 3 months called the first trimester. Then 6 months called the second trimester. The 9 months called the third trimester. Okay. In Indian parents, they have only 0 to 38 weeks of gestational period. Some people only have 0 to 40. Okay, weeks. But in Western parents, they have 0 to 40 weeks of gestational period. Okay. Next stage of lifespan is infancy. Infancy means 0 to 2 years. That is the main years. In that, our physiotherapy people have lot of things is there. The milestone is started from the 0 to 2 years. After the baby comes out from the mother's womb, it will start. Okay. In each month, they shows different milestones. Okay. The continuity of first milestone it comes. Then the baby is come supine, prone, 4 legs. After that, the baby started kneeling, then after sitting, then after standing. Okay, within 2 years, this all milestone should be covered. Otherwise, the baby has some milestone delay or some neurological issues. Then in 0 to 2 years, the patient's sensory and cognitive informations are cognitive developments are comes. Sensory motor developments. The baby start calling, then the baby start crying, baby start angry, baby is annoying. Everything is understood after the birth only. Okay, every reactions will develop it after the birth. Every actions, motor control, head control is coming. Okay, the baby is trying to kneel up and head lifting. Everything is happened in the stage of infancy. This is the most crucial stage of baby. In this stage, our health department will do some measurements. Okay, the baby will milestone is delayed or not, we want to identify. Then the early diagnosis of the childhood problems, and we want to do some further rehabilitation and further treatment. Okay, then in childhood is mainly 2 to 11 years. Okay, childhood is divided into mainly two type. Okay, early childhood and middle childhood. Okay, 2 to 11 years means the person is started to study something. Okay, study something from the society, study something from the peer group, study something from the parents. Okay, who all are my parents, who all are doing things for favor for me, who all are my enemy, everything they understood in this 2 to 11 years. Okay, they understood each and every person in 2 to 11 years. In that period, the child want more parents attention. Okay, then that childhood development is divided into two. Early childhood, that is 2 to 6 years, that is the LKG period. Okay, that's starting this people's preschool schooling, everything is started in that period. That time memory is developing, languaging is developing, cognitive function is developing. In middle childhood means 6 to 11 years. In that, the person 6 years means from first standard. Okay, this started mainly in Kerala. 6 years means the person is joining to first standard. Schooling is started. Before that, preschool. Okay, preschool level, the person's development is started with peer group relationship. Okay, there in early childhood, people understood that babies are understood the peer group attention, everything, the love, affection, then angry, everything is experimenting in their life in 2 to 6 years. After that, 6 to 11 years, their brain is developing and they will be studying more things. Okay, that will improve more emotional control. Okay, everything is comes to 6 to 11 weeks. Okay, then the next stage is adolescent period. Then this will I will take you in next class, adolescence period, because this much is more for you. Okay, today this much you should learn this chapter in your textbook. Whichever textbook is you following, you will follow that textbooks. Okay, then according to your syllabus you can follow it, and my notes is there in this video. You should clearly, I understand that, I feel that. Okay, everyone is replying me in my message, personal message and all. So kindly subscribe my channel and give me likes to my videos, so I can do more videos for you that will help your exams.